But other stories now, pharmaceutical companies that are exiting Nigeria's shores have caused a shortage of medications and a spike in the cost of vital daily drugs for some Nigerians who suffer without them. This crisis has further contributed to the hardship faced by citizens who are in dire need of these life-saving medications. TVC News health correspondent Kemi Balogun reports.
A typical workday in this pharmacy with customers going in and out, but not all of them can afford all of their medical needs as the cost of medical supplies has been put out of their reach. Pharmacist Amade Enejo, who is a chairman of the Association of Community Pharmacists, tells us that some drugs are low in stock and the increase in the prices is due to the exit of some major foreign pharmaceutical companies.
Those that are sourcing it to bring it to this country, they have to go through sourcing out dollar to buy those products from other countries. It's only few individuals that can even source it and bring it into the country. So that is why you are having those shortage. And so you can go through some pharmacy premises, out of 10, maybe 1 or 2 will be able to stock those products because they are not readily available anymore.
Other medicines like antibiotics, antimalarial drugs, allergy relief drugs, and even some over-the-counter painkillers have significantly increased in price. Chima is under the weather today and on her way to the hospital, but she is concerned that the hike in the cost of drugs may affect her access to quality health care.
You see me now, I'm going to hospital. And the bills they gave to me is 3 times more than the bill they gave me last year. So the thing is too much.
I was very sure even the very first time the man told me it's 400. I wanted to bargain and say, no, this is drugs, I cannot bargain. So something of 200, I found it 400. I can't question him because I need to do drugs.
Globally, asthma affects an estimated 262 million people and 455,000 deaths. This was in 2019. Nigeria accounts for one of the highest rates of asthma sufferers, and reports say due to the high cost of inhalers, there has been a 15% decline in the medication adherence rate.
Some experts are concerned that this situation may force some people who cannot afford the high cost of medication to ration it, thereby reducing its effect on the purpose of treatment. And for others who do not have access to the right information or even finances, another worry is the likelihood of many getting caught up in buying fake and counterfeit medication, risking treatment failure and even death.
I know that we have generic products, not really branded product, which is active. Simply put, I'm sure when the bioequivalence and other things are carried out, they can be good substitute for the so-called branded product. And so our prescribers will also work closely with other health teams, including pharmacists, so that generic products, which are cheaper, can be easily substituted and affordable to the reach of the average Nigerian.
The acute crisis of pharmaceutical consumables is now getting more attention from the Federal Executive Council meeting. Coordinating Minister of Health and Social Welfare, Ali Pate, says the federal government is now taking steps to ensure that local manufacturers are supported.
Some of the local manufacturers in Nigeria are struggling. Mr. President's intent is that we begin to take steps to enable the local manufacturers to survive, to thrive, and to deliver the basic commodities that are key to saving their lives.
For community pharmacists like Amadi, their advice to Nigerians is to go for cheaper brands of pharmaceutical products that could be equally as effective. They believe that as soon as government puts policies in motion, it will be easier to get Nigerians back on track to enjoying the full perks of a functional healthcare system. Kemi Balogun, TVC News, Abuja.
The Oyo Osun Area Commander of the Nigeria Customs Service